When we are young, the lens inside of our eye is extremely flexible and allows us to easily focus on close objects. Over time, the lens gradually loses its flexibility, which makes it difficult to focus on close objects. This condition is called presbyopia, and it is a normal part of the aging process that happens to everyone, even those who have never had a vision problem before. In the early stages of presbyopia, most people have difficulty reading small print, such as on a menu, a cell phone, or a newspaper. People usually compensate for this by holding reading materials further away, and in some cases, by using additional light. As the condition progresses, most patients are unable to hold printed materials far enough away to see them clearly. Patients will often complain that their arms are not long enough anymore. At this stage, most patients will require some type of near vision correction. Because the lenses inside our eyes continue to change over time, it is important to see your eye care professional regularly for routine eye examinations.
There are a number of ways to correct presbyopia. Let's use the office setting as a good example of simultaneous visual tasks that most people typically encounter. The most popular method for correcting near vision is with a single vision near lens correction. This lens provides clear near vision with a large field of view. Although this corrective lens effectively clears the near vision, the disadvantage is that the distance objects are now blurry. You can also see that viewing an intermediate object, such as a computer screen, appears blurry as well. In order to clear the intermediate object, you must move your head closer to the screen. This is because the near vision correction is usually set for clear vision at around 16 inches. Computer monitors, like most intermediate tasks, are usually at a further distance. Using a single vision near lens can be visually uncomfortable when multiple vision tasks are required. As a result, we need to talk about a more appropriate lens option. Bifocal lenses offer the advantage of clearing both distant and near objects. Although bifocals have a clear advantage over single vision lenses, they do have certain limitations. One major disadvantage of using a bifocal is the demarcation line which separates the distant and near prescription. This is a problem because it creates a disruption when moving from the distance portion to the near. Another complaint with bifocals is the optical phenomenon known as jump that is created when you move your eyes from the distance portion of the lens through the demarcation line and into the near portion. This causes images to appear distorted or displaced. Another limitation of the bifocal lens is the inability in most cases to view intermediate objects like the computer monitor. As you can see, while distance objects remain clear, the intermediate computer vision may remain blurry. If this is the case, the only way to clear the computer screen is to use the bifocal portion of the lens, and you must move your head closer to the monitor. Constantly moving your head becomes very uncomfortable, especially if computer work is performed for an extended period of time. The inability to clear the intermediate vision problem is the major complaint by most bifocal users, and as a result, a different type of multifocal lens is required. Progressive lenses correct vision in a way that closely resembles natural eyesight. These lenses offer clearer vision at all distances: close up, intermediate, and far away. Those who have considered progressive lenses in the past may be pleased to learn that improvements in technology, such as wider fields of vision, have made progressive lenses easier to adapt to than ever before. The transitions between focal zones are seamless, allowing one to shift focus from far away to intermediate to close-up distances with ease. There are no visible lines between the zones either, so no one can tell that you need the additional help to see up close. For many lens wearers, progressive lenses are a better alternative, offering outstanding clarity and comfort to see at all distances. Most people don't realize that contact lenses can be successfully worn past the age of 40. New contact lens options are being designed each year for people with presbyopia. One option for correcting presbyopia is for you to wear contact lenses for distance correction. Then, for near vision, you must wear reading glasses over your distance correction. This provides the best distance and near vision, but it is inconvenient because you will always have to have your reading glasses with you to see up close. The newest option for correcting presbyopia is multifocal contact lenses. Certain types of these lenses are designed to correct your vision for both near and far, while other designs are able to correct your vision for near, far, and all distances in between. To get started with multifocal contact lenses, your eye care professional may ask you a number of questions to help determine the best lens design for your lifestyle. While multifocal contact lenses may require an adaptation period so that your eyes can get used to them, ultimately, these lenses can greatly enhance your quality of life. Another option for correcting presbyopia is for you to wear monovision contact lenses. In this option, a distance contact lens is fit for your dominant eye, and a reading contact lens is fit for your non-dominant eye. This fitting method is successful in many cases. However, your vision is never as good as when both of your eyes are seeing at one distance, and your depth perception can be adversely affected. Modified monovision is used if you have not adapted to monovision after several adjustments. In this technique, your dominant eye is corrected for distance using a contact lens. Your non-dominant eye is corrected using a bifocal contact lens for both distance and near. Modified monovision offers you improved depth perception and solves most monovision complaints.